Colorado Congressman Gabe Evans is leading a bipartisan effort to close a loophole in Medicaid that he says is leading to identity theft.
He has introduced a bill that would require states to regularly check Social Security files for deceased doctors whose Medicaid or Medicare ID numbers are still being used to bill for services. Evans says the Government Accountability Office identified $54 billion in improper payments for Medicare and $31 billion for Medicaid just last year. The Colorado Auditor's Office recently found 10 major weaknesses at the department that administers Medicaid in our state, including inaccurate billing codes. Evans says he wants to protect the federal health programs for those who need the most by cutting back on waste, fraud, and abuse.
Preventing that identity theft from being weaponized in the Medicaid space by removing providers who have passed on from the system and taking that provider number out of the system as a viable method to get payment is step one in making sure that we reduce these instances of what literally amounts to identity theft of a dead provider.
The bill comes as the U.S. Senate considers a measure that would require the Energy and Commerce Committee, which Evans sits on, to cut $880 billion in spending. Medicaid, the biggest program the committee oversees.